This video will demonstrate the procedure involved in providing wound care, irrigation of an open wound, and application of a sterile dressing using aseptic sterile technique. A full sterile field and sterile supplies will be used during this procedure. Maintaining asepsis is a very important part. Remember the principles of sterile technique. You can't contaminate supplies. If at any time during the procedure you contaminate or think you might have, you must start over with all new supplies. Personal protective equipment, PPE, will also be used to protect you from being splashed during irrigation. The nurse will demonstrate the procedure for donning and removing PPE according to CDC guidelines. The nurse will verify the doctor's order for dressing change. During the lab evaluation, the student will pick a card. The doctor's order will be written on the card. In the clinical agency, it will be in the EMR. The order is to irrigate the abdominal wound with normal saline, pack with sodium chloride moist gauze, and apply a dry sterile dressing. The nurse has completed hand hygiene and will now go and gather supplies from the supply room. The supplies are one 4x4 top sponge or cover sponge, an abdominal pad or an ABD pad, one gauze sponge and specimen cup, normal saline, iodoform and sterile pouch of instruments for iodoform packing if ordered. PPE, which includes gown, gloves, goggles, and mask. One pair of sterile gloves, a Q-tip applicator, irrigation kit with bulb syringe, a blue chucks pad, a sterile drape, tape, and pen. After going into the patient's room, the nurse completes hand hygiene, introduces herself, and explains the procedure.
Hi, my name is Stacy Daniels, student nurse from NCCC. I'm here today to change your abdominal dressing and irrigate your wound.
Identify the patient ×2.
Can you tell me your name,
Kim Jones,
date of birth,
5/25/1980. Assess allergies.
do you have any allergies to medication or tape?
No allergies. And do a pain assessment.
Are you in any pain?
No. Be sure to medicate patient 30 minutes prior to procedure if the patient is having pain. Next will be setting up supplies for the procedure. The patient bedside stand should be cleared off and cleaned with antiseptic wipes prior to using it for any procedure. Set up the bedside table. Put the sterile drape, irrigation kit, normal saline, specimen cup, or iodoform if ordered, on the tray table. Place the garbage can under the table. Place the bed to a comfortable working height. Turn nightside stand at an angle in order to visualize the sterile field at all times. Place remainder of supplies there. Set up the irrigation tray. Fill the graduate halfway with sterile normal saline. Keep syringe sterile by holding it in your hand while pouring the normal saline. Do not place the syringe on the table or back in the tray. If order is for gauze packing, fill the specimen cup to the rim with normal saline. Remember to not reach over the sterile cup. If order is for iodoform packing, open the container and place next to the irrigation container. Prepare tape. Place the barrier tape on the table. Pull patient's gown up to measure the length of each piece of tape. Tear 3 pieces of tape and place on barrier. Write the date, time, and your initials on one piece of tape. Never write on the patient's abdomen. Place blue chucks and basin next to the patient's side to prevent linens from getting wet. Open sterile drape. The label side of the package is up. Open the package away from you. Look for a corner on the sterile field. It should be in the upper left-hand corner. Pinch the corner and lift up the sterile drape, being careful to not touch any surface with the drape. Once the drape is opened, place the side that you are breathing on down on the table. Remember, the outside edge is considered contaminated and you may touch it to open your field. However, do not cross the sterile field. Step away from the sterile field, open packages. Do not open over the sterile field. Fold closed package end over. Peel package from one corner to the next. Open slowly. Fold one side over and grab the dressing. Peel package from one corner to the next. Open slowly. Fold one side over. Grab the dressing. Open the other side of the dressing to cover arm and carefully drop the dressing into the sterile field without contamination. All items must remain sterile. Never cross or talk over the sterile field. No house cleaning should be done during the procedure. Keep field within vision. Don't turn your back. Never leave the sterile field. Keep hands above the waist and in front of you. If using a Q-tip for packing, peel like a banana. Go under the sterile field and grab onto the Q-tip and release onto the sterile field without contamination. If the order is for iodoform packing, then the utensils must be dropped into the sterile field using the same technique. Step away from the sterile field and don PPE, which is used to protect from splashing of microorganisms or bacteria in the wound. Apply PPE by first putting on the gown. Be sure it is tied around the neck as well as around the waist. Apply the mask with color side out, pinch over the nose, and adjust to cover the face. Apply goggles and clean gloves. Be sure gown is tucked inside the gloves. The nurse will then peel back tape and remove the old dressing. Remove dressings one layer at a time to prevent pulling out any drains or tubes. Remove dressing toward the patient so the patient will not visualize drainage. Assess each layer of dressing for drainage, amount, color, and consistency. Complete wound assessment. Assess for RETA, redness, ecchymosis, edema, and drainage. Review type of drainage that might be seen, such as serous, sanguinous, serosanguinous, or purulent. The wound is not approximated because it is an opened wound. After the dressing is removed and drainage and wound are assessed, remove gloves and dispose. Apply a new pair of clean gloves for irrigation. We'll now turn the patient on their side to irrigate their wound. The irrigation tray is next to the patient, so it will collect the fluid as the irrigation is done. Fill the syringe with normal saline. Irrigate the wound with back and forth motion, starting at the top of the wound. Do not irrigate above the wound. This may cause bacteria above the wound or on the skin to enter the wound. Irrigate until clear. Wipe excess fluid with the chucks around the wound, not inside the wound. Turn patient on the back. When irrigation is completed, goggles and gloves may be removed because further splashing will not occur once the wound irrigation is completed. However, for demonstration purposes, the nurse will leave the goggles on for demonstration of PPE removal at the end of this procedure. The nurse will now apply sterile gloves without contamination. Open the outside wrapper by carefully peeling the top layer back. Remove the inner package, handling only the outside of it. Place the inner package on the work surface with the side labeled cuff end closest to the body. Carefully open the inner package. Fold open the top flap, the bottom flap, and then open the sides. Take care not to touch the inner surface of the package or the gloves. With the thumb and forefinger of the non-dominant hand, grasp the folded cuff of the glove for the dominant hand, touching only the exposed inside of the glove. Keeping the hand above the waistline, lift and hold the glove up and off the inner package with fingers down. Be careful it does not touch any unsterile object. Carefully insert the dominant hand, palm up into the glove, and pull the glove on. Hold the thumb of the gloved hand outward. Place the fingers of the gloved hand inside the cuff of the remaining glove. Lift it from the wrapper, taking care not to touch anything with the gloves or hands. Carefully insert the non-dominant hand into the glove. Pull the glove on, taking care that the skin does not touch any of the outer surfaces of the glove and that thumb is not contaminated. Hands are now sterile. Keep them above the waist. Okay, for gauze dressing, pick up the dry gauze and open the entire gauze away from the sterile field. Grasp and put into the gloved hand. Moisten gauze with normal saline, being careful not to touch the outside or the rim. Squeeze excess water. Reopen using the sterile gloved hands. Fold the moistened gauze loosely into the palm of the hand, holding the end with the fingertips. The cotton swab may now be used to guide the sterile gauze into the wound, or just a sterile gloved finger may be used. Do not contaminate the fingers, gauze, or cotton swab at any time during the wound packing. During the lab evaluation, you will pack the wound with one gauze. At a clinical agency, you would use as many gauze as needed to pack the wound completely. If the order is for iodoform gauze, using sterile scissors and tweezers to cut the gauze. Put the gauze into your hand. Drop the tweezers on the sterile field. Use the sterile scissors to cut inside the container. And proceed with packing the same way that the sterile gauze was packed. Cover wound with 2 cover sponges. And the ABD pad. The blue line Must go on the outside. Secure dressing with tape. Make sure patient is comfortable and safe. Bed in the low position. Call light and personal belongings within reach. Clean up and dispose of garbage per agency policy. The final procedure is to remove the PPE. Remove PPE per CDC guidelines. Remove gloves as shown. Remove goggles. Remove gown by untying the neck and the waist. Let it fall off the shoulder and touch the inside to pull it away from the body. Turn it inside out as it is being removed. Finally, remove the mask by using the loops. Complete hand hygiene before leaving the patient's room. In the clinical agency, you would then document wound assessment, drainage, dressing change, pain assessment, and if patient medicated, and how patient tolerated procedure. In lab, verbalize that documentation is completed. This concludes the skills video for Asepsis 1, sterile wound irrigation, and packing a wound.